Welcome to this special series of Diabetes Core Update titled, What's Next? This is a podcast series by the American Diabetes Association where each episode explores the cutting-edge world of diabetes-related treatment and care, looking at new and future enterprises advancing diabetes and obesity care. This discussion series features interviews with leading industry representatives, researchers, and innovators who are shaping this care now and to the future, from groundbreaking new products and treatments to the latest research advances to new processes of care. What's Next aims to have a broad scope and offers a look at the innovations that are set to transform our landscape and really change the way that you and I care for diabetes and related metabolic conditions. This special edition of Diabetes Core Update's What Next series is sponsored by Ciba Health. Today we're privileged to be talking with Clement, who is the CEO and founder of Ciba Health. Innocent, welcome to Diabetes Core Update.
Hi, Neil. Thank you so much for taking the time to connect with me this wonderful, beautiful day here in New York City. Really, it's a pleasure to be here and be part of this important conversation.
And I'll tell you, picking a time is not easy with you. The last time we had a time all set, you emailed me quickly from Dubai because your flight was running late and there was no way you're going to get here on time. So you are moving around a lot. You're in a lot of places. I know you're getting Ciba off the ground, making it work, and doing a lot of travel with it. Sounds very exciting. So I am so happy that you're able to make the time to be with us.
Absolutely. This is incredible. It's also very important for me as well as really our audience. And again, like you said, I really appreciate your flexibility to really, again, take our time to connect with me. As again, a life of an entrepreneur involves a lot of travels, meetings, and really ensuring that we are aligning with the stakeholders and both internal, external, and really key opinion leaders in the space. And again, as we begin to build Ciba, our goal is to build a global business, not just a business that is focused on the US alone, but that is also going to make impact across the globe. So I'm really excited to be here and look forward to the conversation.
And that's an exciting idea. Can you tell us a bit about Ciba Health, what gap you see it addressing in the healthcare landscape?
Absolutely. And so first, let me probably share with our audience really what Ciba is today. So Ciba really, it's a digital integrated healthcare platform really designed, one, to prevent, manage, and also to really empower patients with some of those complex chronic conditions today, particularly type 2 diabetes, obesity, some of those are cardiometabolic, which is suddenly, it's a huge cost driver for individuals, health plans, employers that are self-funded today. And so Ciba started in 2020. Today, Ciba is currently across the 50 states in the United States. We also have established our presence in 3 other countries, which include Canada, the UAE, and China. And really, when you look at the size of the problem today, looking at even type 2 diabetes, in the US, you have 1 out of 9 really either have diabetes or they're pre-diabetic, or they don't even know they even have it, right? So same applies to UAE, 1 out of 4. So it's really an important time for us to begin to think about how can we better address the gaps. So for me, when I looked at the gaps today, what are those gaps? I looked at it in twofold. One is healthcare is often reactive rather than proactive, right? And the thing is with the current care model, it's focusing on what I call the symptom management instead of trying to understand what is the root causes of the type 2 diabetes today. What's actually causing it? Why do you even have it today? And so that's one of where the problem is today. And the second one is patients are also frequently left to navigate the fragmented solutions themselves, which is also very challenging for them with little guidance and also this lack of what we call personalization. So at Ciba today, we've built a comprehensive data-driven, highly personalized care model that combines medical care, nutrition, mental health, and behavior change into one unique platform. Our goal is to empower individuals to take control of their health and really help employers and health plans to improve outcome while also reducing costs, right? So it's really building this sort of very comprehensive integrated platform that leverages multidisciplinary care team in a coordinated way that put the patients in the middle to be able to really address a lot of the pain points that we've seen in the space today.
Now, Innocent, as I'm listening, I'm just in awe of your breadth of vision. And I'm wondering, can you tell us a little bit about your background? How did you develop this breadth of vision and this idea that includes broad care, that includes personalized care and empowerment of patients, not just from a medical point of view, but a behavioral point of view?
Absolutely. And my journey as an entrepreneur started in early 2015 when even digital healthcare wasn't really very popular, or people were like, what is going on here? That's where my journey started. But again, I am a trained physician and having spent time in my career looking at chronic disease management today and patient care delivery models. What struck me over and over was, despite the advancement in medicine, patients with chronic conditions, especially diabetes, continue to experience fragmented care, poor outcomes, and a sense of frustration. And this is not just the patient alone, right? Even me as a provider, I am also frustrated, really managing the same patient over and over again. And I felt that the time it's actually now for us to begin to think about the current traditional care model and build a model, one, that put the patient in the middle, and a model that can really deliver better outcome, and then also help to remove the frustration in the space. So I learned a lot from my journey in 2015, which was with a different startup that I also co-founded with my friends in 2015. So I led that to somewhere around 2019, where I decided to exit that to really focus on Ciba Health today. And really, while I was building that prior startup, I had the opportunity to interact with stakeholders, even patients themselves, but also employers that are self-funded, that are providing benefits for their employees, and as well as really interacting with executives from health plans that are looking for solutions that can address the current care model, the hair on fire problem, and the gaps in how care is delivered and how their members access care. So that got me thinking, how can we now begin to address some of those hair on fire problems? And Ciba started in 2020. Really, again, with the goal is to see how can we really create a solution that goes beyond the traditional approaches, leveraging cutting-edge technology, and really delivering this root cause approach to drive sustainable change. The desire, again, combined with personal stories that I've witnessed practicing as a clinician, inspired the creation of Ciba in 2020.
That's so helpful to hear that perspective, and I think a lot of our listeners would agree that we, at its core right now, there's a lot about medicine and medical care that is frustrating for clinicians and frustrating for patients. We all know that the cost is higher than we'd like, and the outcomes that we achieve are not as good as we like, even though we have these amazing medicines at our disposal that we can use and amazing technology that we can bring to bear. And yet everyone is frustrated and everybody is concerned about cost. So it seems like that vision comes from that place of a true clinician experiencing it. Now, let's try and break down some of the challenges that you are trying to address and then how you're going about addressing them.
Yeah, it's a very important point that you brought up. I mean, when you look at, for me, I am really big on saying we provide as clinicians, all of us really looking at this problem in a very holistic way. We are very closer to some of the challenges that we've seen in the space, some of the gaps in the care model. And I strongly believe that we should take a lead in really making the change, making the difference. I know more often than not, I mean, a lot of us clinicians, we're very comfortable with the work today and not thinking about how can we continue to innovate. This is not simple. It's not ABC. it comes with its own challenges. And really, you need to enjoy doing what you do. You need to be passionate about it to be able to begin to think about how do you overcome some of those challenges, and then how do you really become that agent of change that can help to really build this sort of ecosystem that would also allow our patients to benefit from it. And the challenges there, one, I could say, is the fragmentation of care today. And as a clinician, patients often see multiple specialists, mostly patients with some of those complex chronic conditions that include type 2 diabetes. And a lot of times they receive conflicting advice and are often left to themselves to coordinate it all by themselves. And which is suddenly, can you imagine a patient going through all this? And then the patient is left all by himself, he or herself, to really begin to figure out, how do I coordinate reaching out to either the doctor or the endocrinologist or the dietitian or the health coaches that are there to really help you, to really support you and handhold you. And because of all that, I thought Ciba, it's there to really build this integrated ecosystem where medical doctors, dietitian, health coaches, doctors, behavioral health providers collaborate with the patient in the middle. So we call it really patient-centered sort of care model. And another challenge also that I would also love to mention here is the lack of personalization of care, right? And as diabetes isn't the same for everyone. So for us, how do we address that? Is to really use the advanced analytics and then predictive modeling that is tailored to each individual's journey based on some of those biomarkers testing that we do, looking at lifestyle factors, behavioral data, making care both precise and proactive. Because once you have this key element, you're able to deliver a better care model, a care that is precise, a care that is also proactive, moving away from that reactive sort of care, moving away from that Band-Aid approach where we'll put a Band-Aid, suppress the symptoms. And so this is some of the challenges that we've seen in the space, when again, the fragmentation, and as well as lack of personalization, where we do a one-size-fits-all approach.
That's interesting. Now, let me focus for a few minutes when you said a patient's behaviors and allow that your platform allows us to personalize things. How do they input that behavior? Because I know when I see someone in the office, I like to think I address behavioral issues. I ask them what they're doing with regard to exercise and diet, but I also know that the information I get is probably not very accurate. They're summarizing from memory the last 3 to 4 months of everything that they did. Do you use any personalized data input on an ongoing basis?
Absolutely. It's very important, right? Again, it's one of the challenges that we have with the traditional care model today. So what Ciba has done today is to integrate some wearable devices where we have the continuous blood glucose, right, that helps to modify behavior, that also helps to empower patients. Again, the CGM allows them to also continue to track their blood glucose, right, and see how well it's progressing. And it allows them to identify certain trends in terms of spike in what they eat. And it sends notification for them and say, go for a 15-minute walk. And that allows them to lower the spike in the blood glucose. We also provide patients with what we call, there's a blood pressure monitoring devices that we provide our patients. There's a scale that measures their weight, their BMI. There's also an activity tracker. It's all integrated into our platform using what we call the remote patient monitoring capabilities. And this RPM has a dashboard, both for the providers and as well as for the patient. So you're able to track data trends that is coming from all those wearables today real time. And it's also able to flag certain trends in the data, what is trending in the direction that it shouldn't trend. And it also empowers the patient themselves, right? And then for able to see how well are they progressing. And with that, they also have the health coach that's a part of that. Those health coaching are like the quarterback, right? They're there to see how well the patients are doing. And then we also have what we call behavioral therapists as part of the care model, because we also know that behavioral changes, lifestyle modification, it's not easy at all to do. It's very difficult. So we want to ensure that these patients have all they need within the same platform. So that's why we provide that one platform that provides all the integration with the devices, that provide notification, that send them nudges in terms of, you need to probably go for a 15-minute walk, or we notice that you have not slept well last night. And really, how can you improve your sleep hygiene? We'll also be able to track and see what do you eat every day. It correlates with the spike that we see in your continuous blood glucose and see, okay, and it's time stamped. And this information allows us to say, okay, maybe you ate, okay, it's a bowl of rice that you ate today that's actually spiking this, or there's something else in the food that you ate that is also spiking, causing the spike in your blood glucose. So the patient, when they see that, it gives them empowerment. It allows them to be able to see, oh, maybe I should minimize this. And also really nudging them to go for a 15-minute walk as a clinician, that also helps. Hence why we provide them with this sort of connected devices that we're also able to see, and then so that the patient do not have to remember from memory, but there's a dashboard, there's a data that collects all that information in a structured way that is also presented to the clinician, but also the patient, they can also see and track their progress. So it allows, that's why I said it's very important that we really build this sort of digital framework that allows us to continue to see how can we better support patients and leveraging this data analytics and the predictive modeling that is tailored to each patient journey based on each of their biomarkers and lifestyle factors or behavioral data that we see.
I am fascinated by that idea of notification. So we know that, for instance, with CGM, when patients use CGM, it creates a feedback loop that even without adding any other medicine, and there's very good data on this, people drop their blood glucose and their A1C by about the same degree as adding an additional medicine, anywhere from 0.5 to 1% in that range. But for other things like activity trackers, weight, blood pressure, even tracking what you eat, it's always struck me as challenging for patients to connect the dots, to say, here's what I'm doing, not get overwhelmed by the data, but turn that into an action plan. It sounds like you're doing that in the background and actually proactively sending notifications for action to patients. Is that right?
Absolutely, that's absolutely correct. And like you said, it can be overwhelming for patients. And mostly patients with some of those complex chronic conditions, they're already dealing with so much. So for us is really, we look at the trends in the data that really the technology is built in a way that it tracks the trends over time and then send the important notification and nudges in terms of what you're expecting the patient to do. But the patient, obviously, they have access to that data. They can see. And this data is structured in a way that it's also color-coded, and it highlights and flag specific trends in those data for them to really take action or make certain decisions. But for us, it's also important. That's why we also have the health coaches are also there to really be able to look at that and also handhold and support those patients that probably are having difficulty really be able to really make some of this progress or the decision in terms of what's coming and also ensuring that they are not overwhelmed. Right. So it's not just technology alone, but it's also a human component. And the way we call it at Ciba Health is high touch, high tech. So it's a combination. It has to be a balance of technology. There has to be the human element there as well. They all would have to go hand in hand. They work in parallel. So high touch, high tech.
This is phenomenal to listen to because when I think about all these devices and all this data, I always get afraid that we lose that personal touch. And the truth is, we're all people. We can have all the data in the world, but if we don't have someone listen to our fears and our aspirations, the data falls flat. And it sounds like you've figured out a way, a cost-effective way, to utilize health coaches to give that personal touch, to be able to listen to a patient. Is that right?
Absolutely. The health coaches are usually like the quarterback, right? So the goal is to see how can I support you and then handhold you. As a patient, when you come on the platform for us, first thing we want to do, we want to establish a goal. What are you looking to achieve today? We want to establish that, right? And ensuring that we're working with you to understand how can we better support you. And once you do that, one, you build trust, you build relationship. You also empower the patient to really be a part of their own care journey so that they can really, what I call the captain of their own care journey to navigate some of this. But again, it's not just easy to just say, but it's also important to ensure that you have all the support, right? Could it be behavioral therapist? the patient sometimes might need it, right? A lot of members with some of this complex chronic condition, there's an element of mental health in there. We want to be able to provide that whole person care model that look at you as a patient as a whole, but not just looking at and say, oh, you have a headache, let's manage the headache. No, we want to look at you as a whole because as the entire human body is connected, and really want to ensure that we are really helping you to deliver this care model that's a whole person, that also empower you as a patient, that also really provide you with the trust that you build with your care team, which is also no longer here today, right? Because of the way the traditional care model is built today, it's all about very transactional. But we want to be able to make it easier for both the patient and the provider so that they are not overwhelmed. And hence why the system is built the way it is to ensure that we're able to support the patient that needed it the most.
So we've talked about the patient, and it sounds like the ability to get real-time data is very well honed. It sounds like the ability to feed that data back to the patient with notifications, with a person going over things is also well honed. Where does the patient's physician fit in, the primary care doctor who's out there working hard, we're trying to do our best, and how do we access that information? How do we remain a important part of that person's care?
Neil, this is an incredible question. And as a clinician myself, I know that it's important to ensure that we carry the patient's PCP or whatever provider they're seeing along as we continue to support this patient. Our goal is not to replace the patient primary care provider, right? Our goal is to really complement and extend their reach. And our platform really provides real-time insight reporting that can be shared with the PCP and also really communicate directly with the PCP where it is appropriate, creating a true care team around the patient rather than working in silos. Because the challenge with the care model today is because a lot of what we do today is always in silos. For us, is we want to ensure that everybody who is surrounding this patient, that's why we call it a patient-centered care model. The patient is in the middle, you're surrounded by the care team, and this care team have access to your data real time, and they're able to really understand what sort of information is coming through. And so Ciba, we build it in a way that will integrate seamlessly into top EMR system that we have today, either Epic, Cerner, or Meditech, because we also understood the challenges that we have in the care model is how do you push data, but also not to overwhelm the care team and the primary care provider. They're already overwhelmed, right? I mean, obviously with the challenges of the system today where sometimes patients don't even have access to PCP. Ciba can also take on and be that patient PCP. But our first goal is to really complement what they're already doing and extend their reach.
You were reading my mind about that integration, and clearly you've thought a lot about that because it becomes important, one, not to have to look into different systems when a patient's in front of you. So you've thought about integrating it with the most important EHRs that we all use. Yeah. And it actually is fairly remarkable, Innocent. When I first started listening, I was concerned about where this all fits in, and you answered that question more than sufficiently, because I want my patients to get this sort of feedback that I can't give them. If they had a little me on their shoulder every day saying, you're not walking enough during this time of day, your CGM said this, that would be great, but I'm not there. They see me once every 3 months if they come in. And what's beautiful is you've really described a wonderful adjunct, that this is truly a partnership that we have. As you said, you could provide all the care, that you have that ability, but that for a lot of people who do have a very important source of care, this works as a wonderful adjunct. Can you share with us examples of what the results of that use have been?
Yeah, absolutely. And as like you said, right, I mean, it's important. One of the reasons why we started Ciba is to really see how can we really help patients to improve their health, deliver better outcome, provide access wherever they are when they need it. And when we set up this, we spoke to stakeholders like employer that are providing benefits for their employee. Our goal is to see how can we help them, one, to improve access for their employees or their associate and deliver better care when their members need them. And that also ties back to the cost of managing patients with some of the complex chronic conditions today. What we've seen is 5% of an organization actually cost about 50% of the self-funded money that is set aside for an employer to manage everybody. So you can imagine you have 1,000 employees today, and you have 5% of your employees actually costing you 50% of that money that you set aside for everybody to benefit. Which means if you don't do anything, you only have 50%. And how are you going to be able to distribute that across the 95% that are still needing access to care? And our goal is to partner with employers, payers, TPAs, even individuals. And what we've seen since about 4 years now that Ciba has been around, we were able to really achieve a significant engagement. Members achieve significant reduction in their A1C level. So what we've seen an improvement in A1C level of 2 points or even greater for those who are actually indicated or diagnosed with diabetes, right? With nearly half of this patient reducing or discontinuing a lot of the medication that are sometimes they're on, and then really make some remarkable lifestyle changes, leveraging some of the technology that we have today that has helped them to sustain improvement across books of business for most of our clients today, which include the employer or the payer today. And really, as long as the patient actually adhere to a care plan and then really leveraging the technology to stay engaged and continue to really monitor and manage their condition, we see significant improvement. We've seen weight loss of close to 30 pounds on average for around 12 months of engagement if they continue to engage. As if you lose 5% of your weight, that is also significant, and it also correlates with how your health would also be trending, right? So we've seen a lot of remarkable progress there. Patients either get off some of this expensive medication, which also help them to lower their cost, either out of pocket or for the employer themselves. But really, for 4 years or 5 years of Ciba's existence today, we also took a step further, that we went to validate our data with a third-party validation institute that looked at the data in terms of outcome that we measure for success and really give us a stamp of approval that it also actually guarantee that Ciba can deliver high engagement, better outcome, lower cost, better access at a fraction of the cost today. And that has been very significant. So when we go to talk to clients, the first thing they ask is, what sort of data do you have to support a lot of claims that you're making today? And really, Ciba has really leveraged that. Again, as a clinician myself, I know the importance of data that validate whatever claims you're making. You're not just promising, but you're also showing that you have data that supports it.
That is fantastic. Now, I imagine that another advantage, and I've heard the term presenteeism to describe people who go to work but are not working optimally. That's different than absenteeism when someone can't go to work. But presenteeism is very common, and chronic disease contributes to that. I have to imagine that if people are feeling better, if they are eating better, if they're more active, if they are having their emotional concerns addressed, less depression, that they perform better at work. Is that also a hypothesis that you've thought of? I'm sure it's harder to get data on that.
No, I mean, it's a very incredible insight that you shared there, right? Obviously, with an employer, they measure all that too, right? And then you'll be able to track that from claims data. So we have access to the claims data. We know how often, how frequently they either call out from work and go to the emergency room, or when they're even at work, right, they're not able to focus because they're going through a lot, right? So hence why we provide them with access. They can download the app. It's right in front of them, and they're able to communicate and connect with our care team, either via chat or log onto their app, their phone, and connect with the care team if there's any concern. It's almost like a 247 sort of support that you provide this patient. And so if they're at work, they're not able to focus because they're dealing with a lot of this issue. And as presenteeism, it's also it's a significant cost driver for employers. You're not going to be able to be at your best. You're not going to be able to deliver. If you work in a manufacturing facility, you're going through all that. How are you going to be able to focus? How are you going to be able to manage the line in terms of production, right? So it's a huge problem. So we measure presenteeism. We also measure absenteeism. So we look at some sort of data with the patient. We send them a questionnaire. We ask them questions around how are they doing today? Are they able to focus on a daily-to-day basis? Are there anything that is bothering them? How can we better support them? So we collect all that data and able to track that and report that back to either the employer or even the health plan to see how we are supporting this patient to reduce presenteeism and improve really productivity, and as well as also reduce the absenteeism when they have to call out from work and either go to the hospital. As chronic condition today, most patients with this condition, the tendency is that they would actually call out of work and then really go to a healthcare location or go to even to emergency room. Our goal is to reduce unnecessary hospital visit if you don't have to, and even emergency room visit. As you go there, obviously there's huge cost associated with that. And then you could go to the emergency room, you could be there for 4 hours before you get seen. And that's how we measure presenteeism, absenteeism, really to ensure that we're able to support members. And hence why I said earlier on that we ensure that we do what we call a goals setting, where we're able to ask these members what is most important to them today, and then ensuring that the goals that we set for them, it's attainable, it's also achievable.
This is really fascinating. You've taken this large vision and you've explained to us how it is, how you've implemented it with regard to incredibly particulars. Now, you must have faced some significant challenges over the last few years doing this. What do you see as the most significant challenges you and your team have faced in building and then scaling Ciba Health?
I mean, so like I said earlier to you when we started, the journey of someone who is considered him or herself an innovator or an entrepreneur, it comes with significant challenges. And the most important thing is you have to enjoy the journey. You have to be passionate about the problem that you're solving, because it's not going to be easy. You're going to be faced with a lot of challenges along the way, a lot of hurdles. What will make you continue to do what you do is because, one, you enjoy it. Two, you're passionate about it. Three, you're really driven to make an impact and make a difference, right? In not just within your community, but also looking at it globally, right? So obviously, when you come with a solution like this, one of the biggest challenges that we face is really in the market today is how do we educate people so that we can move away from this mindset of quick fixes, really that is geared towards a long-term, rather than a point solution, but a solution that is geared towards a long-term success, leveraging what I talked about, root cause approach. What is the root causes of this condition today? So you want to continue to provide education, you want to continue to create awareness, you want to be able to carry along all the stakeholders today to understand the importance of the work. One, from a provider perspective, how is that going to make their life a lot easier to better manage their patient and have this longitudinal data? If the patient is going to come back to you in 3 months, how do you know how this patient is doing today at home? You don't have any access to data. So for us to be able to provide you that, and also really to be able to build a solution that we think it's scalable, a solution that's also really cheaper but deliver better outcomes. So you have to continually provide this education, awareness around what you're building, how this is helping you to move away from quick fixes and really towards a long-term care model. What I mentioned, another thing is also really, another challenge is really building trust, right? I mean, when you go to a health plan today, the first thing that comes to mind is maybe they have about 1,000 other different solutions reaching out to them today, right? And even the employers today. So they get 1,001 different vendors reaching out to them and making claims and say, oh, we can help you with this, we can do that. A lot of them are promises, right? I mean, do they have data to support some of those claims? As a startup that you started, you don't have data. It's also going to be challenging for you to be able to get your first client because no one want to take the risk. And then where do you get data if you don't have a client? So what we've done was to say, okay, we're going to go directly to consumers directly and then be able to collect data and from early adopters of the solution and then use that data to begin to have conversation and say, hey, we have 1,000 of your members who are actually Aetna members are using our solution today. We've been able to really help them improve, make some lifestyle changes, behavioral support. We're able to improve their A1C level. We're able to improve their weight. We're able to improve their blood pressure. And so when we go to those clients, we go there with really evidence and then making commitment and then saying we can actually even put our revenue at risk because we trust our solution works. So we invested heavily in clinical validation and then looking at real world data and then build case studies. And this all require a lot of resources, right? And again, coming in, building a solution, if you have not raised money or if you don't have the means to do that, it's always going to challenge you. But because we knew exactly what we're looking to do, and we invested so much of our own money into this so that we can collect and so this early data that validate a lot of claims, that has significantly helped us to really gain momentum in the space today.
Absolutely fascinating. If clinicians who listen to this podcast want to refer their patients to Ciba Health, how would they do that? We're
partnering with, one of the reasons why we're partnering with ADA, right? The goal is to really, which is American Diabetes Association, is to really create awareness of the Ciba's approach to help a patient with some of the complex chronic condition. We are also we're doing webinars. We're also really, again, this podcast is also another way to really be able to communicate the value of Ciba and then create visibility and awareness, right? Members can actually go to the App Store, download the Ciba app, have access to this, right? So we're also partnering with CDC today, which is also helping to really share what Ciba is doing today. We've been working with CDC now for close to 4 years now, looking at patients who are at risk of type 2 diabetes. So we're going to leverage the mediums like what we're doing today to create awareness. We're going to partner with community stakeholders. We're going to partner with religious organizations and to really be going to create awareness of the solution. We're also going to partner with health systems as well, like providers like yourself, and then to share the work that we're doing and how can we better work collaboratively to connect to help to better manage patients with some of those complex chronic conditions that are already frustrated.
Very interesting. Innocent, we're about out of time. Are there any final thoughts that you want to share with our listeners?
Absolutely. For me, I think when I look at the future of the care model today, it's going to be more integrated. It's also going to be, where we leverage technology, it's also be able to predict and prevent. And there's also going to be this continuous monitoring of patients' blood glucose, right, and leveraging AI today, as AI is really playing a significant or a central role today. So that would allow us, one, to identify risk, two, before actually it manifests, but it also would allow us to really move care further upstream, right? And then focusing on really metabolic health optimization and not just management. Hence why, what we're building at Ciba today, we believe that we're building the future of care at Ciba Health today. And again, like you said, if there's one thing I want to leave to our listeners today is to really say that type 2 diabetes and other related metabolic conditions don't have to be lifelong burden, right? With the right approach, and when you focus on why do you even have this condition today and build this personalized care and deliver a sustained behavior change, we can truly transform lives. And that's what drives us every day at Ciba Health.
Dr. Innocent Clement, thank you so much for joining us.
Thank you so much, Anil. Thank you for your time. And I'm really honored to be invited to really share the work that we're doing today. It's been a privilege to share what we're building at Ciba and be a part of this important conversation.
I have to tell you that certainly when we think about our goals with the American Diabetes Association's What's Next series, our goal was to talk to agents of change, to talk to innovators in care, to talk to people who are taking those big issues and translating that into action on the ground, and you certainly have fulfilled that promise for us. I think that you've taught me a lot. I love the idea of high-tech, high-touch. that really combines the things that we as people need out of this amazing technology that we have. Most of all, as always, I want to thank our listeners. Thank you for joining us in this special series of Diabetes Core Update called What's Next? This is a podcast series by the American Diabetes Association where in every episode we explore it like we did today, cutting-edge change in diabetes-related and metabolic-related treatment and care, looking at new and future enterprises that advance that care. This special edition of Diabetes Core Update is sponsored by Ciba Health. We thank you for listening. For the American Diabetes Association, I'm Dr. Neil Skolnik. Till next time, stay safe and keep learning.